COVID-19 has impacted the world in a way hopefully we'll never see again. And as patients, I'm sure that you're very concerned about visiting the dental practice, and I share your concerns. I want to go through a few items that we have changed at the practice so that you are secure in the knowledge that Anacapa Dental is doing everything possible to keep you safe. So there are certain things and certain protocols which have changed, and we are changing the way we do things. So I'm just going to run through a few items that you should be aware of. First and foremost, we are complying to all of CDC's regulations and standards to ensure that both you, our patients, and my staff are as safe as possible. So just going through the items that we've implemented. First things first, unfortunately, we no longer have patients sitting in our waiting room. So as you arrive at the office, you'll park in the front of the office and you'll give us a call. And essentially we're going to give you a time that you can come in. The reason for this particular change is that we're having a policy where we have one patient in and one patient out. Many of you that have visited the practice know that we have a very large practice and we have 8 rooms. And we have separate operatories, meaning that there are walls in between each area. That allows us to see at least 4 patients spread out very, very well, so that we can respect all the parameters of social distancing. So that is one of the things that we do. The second thing that we do is when you call for your appointment, we're going to do a general phone screening. Whether you are a new patient or an existing patient, we're going to go through your medical details, we're going to go through your travel schedules, we're going to go through the various items that have been mandated really by the CDC, so that we can keep, once again, you and our staff safe. The third thing we have implemented is in terms of instrumentation. There are a few things which you may notice as you walk into the office. The first thing we have implemented, we have very large HEPA 13 filters. You're going to see this air filtration in every single room, and one large HEPA filter in the waiting room, so that we can span our whole practice. And the purpose of this is to ensure that we have clean air. Now once you come in and you start to see the hygienists use what we call ultrasonic instrumentation. And the ultrasonic instrumentation can generate what we call aerosol. To combat that, we've actually incorporated high-end suction units. These are extra-oral suction units which we've ordered. We have one for each hygienist and 2, 3 for us when we're seeing patients. What these extra-oral suction units do is that they suction away all of the aerosol. So once again, with the HEPA 13 filters and the extra-oral suction units, you can be sure that you're being kept safe, and the amount of aerosol spread is minimal, to say the least. Now when you visit me, we like visiting each other, right? What we've actually also incorporated, as well as the extra-oral suction units, we've incorporated additional intraoral suction measures. And what you'll find is we're going to give you a bite block that you're going to bite down, and these suction units once again will ensure that there is no aerosol spread. So we're trying to do everything possible to keep you safe. From a cleanliness regimen, as a dental practice, we are used to cross-infection and having the strictest standards in cross-infection control. On a day-to-day basis, we deal with patients who've had HIV, Hep B, various other viruses, and we take every single measure to prevent cross-contamination. As additional measures, what we are doing to clean the rooms is that we are fogging with hypochlorous acid to ensure that the rooms are very, very clean. Each room has a timer in it, and we do not allow another patient to be treated in that room for up to an hour. So that's how far we're really going to ensure that our environment is clean and safe. One of the last things that we've also incorporated is UV lights and sanitizers, and we find that sometimes with phones and keyboards and just basic surfaces, we sanitize with the UV lights and sanitizers. Our staff is dedicated to keeping you safe, and both front office and back office, we have a scheduled maintenance routine whereby all surfaces, all handles, all restrooms are all wiped down. with disinfectants to ensure that we are keeping our facility free of the coronavirus. So I understand, despite all of these measures, you are probably still a little bit concerned, and with all the stay-at-home, lockdown measures which the governor is putting in place and the stay-at-home orders, I know you may be worried about visiting the dentist, but I want to assure you and comfort you that, even though there's a lockdown order, we are considered an essential business. And those of you that have, been to the office know that we deal with a lot of extensive situations. And, from my perspective, I can't abandon you as a patient. So we ensure that, we are open, we are seeing patients, and we are seeing patients as safe as possible. It's a very, very important time to take care of your dental health. Your mouth health impacts the health of your body. So visiting your dentist, visiting your hygienist is certainly critical to maintain your overall health. So, please be sure that we are doing everything possible and we are keeping you safe, keeping our staff safe. And if you have any questions or concerns, please feel free to give us a call at 805-988-8985. We'll be sure to answer any question you have. We hope to see you soon, and keep safe.